I am.
Okay, so I'm gonna start kind of at the top here, and I'll walk through parts of the chest, and then I'll kind of flip him around and kind of talk some of his back muscles. All right, so I like this this model because you can see the facial muscles really well. Okay, so right here at the top, you can see his frontalis. That's the forehead muscle. On top of his head, just like on your models, you can see is that flat tendon-like structure, the epicranial aponeurosis, and then that continues around back, and it's not very good on here. If I don't knock them off, would be where the occipitalis is, and which might be what they're showing there, but it's not really the best. Now, what you can see really well, orbicularis oculi on his right eye. It's been removed on his left, so we can kind of see some more of the facial bones. And then the orbicularis oris really well around his lips. Okay. The masseter muscle, very visible. That's one of the big chewing muscles. And then the other chewing muscle is shown up here. That's our temporalis muscle. Okay. Really good over here. Actually, I like it better over here. Okay. That would be the temporalis muscle. Much better over there. This one, I'm not sure. Maybe that's just actually the auraculus muscle. Not that it's super important. Okay. And then as you move down into the neck, sternocleidomastoids, very visible. Notice that there's no platysma. If the platysma is on your list, you can cross it off because I don't have any models on the platysma. Okay. In the chest, on his right side, you can find the very visible pec major, and on the left side is where you can see the pec minor. On both sides, you can see serratus anterior really well. We have in the abdomen the rectus sheath on one side and the deeper rectus abdominis. Remember, the rectus sheath would cover both sides, but they've removed it over here. Okay, linea alba running right down the middle, and then the tendinous intersections splitting those in two different parts. External obliques. Okay. Now, what's nice about this model, if I can do it without it completely falling apart, is I can pull the chest off. Okay, and I might actually do this on the test, so you can see the transverse abdominis. Remember, the rectus abdominis, the fibers run vertically. Transverse abdominis, they run horizontally, deep to that rectus abdominis. Okay, you can see the intercostals. Remember, intercostal muscles are between the ribs. I'm guessing those are internal intercostals, but odds are I probably won't worry too much about those on the test. A muscle that you can actually see pretty well, and I don't know if I'll use it or not, would be this diaphragm muscle. Okay, this is visible in this fella here, but it's also visible in your little guys that you guys have at the table. Okay. You should be able to find your way through the various arm muscles on your own. Those are pretty straightforward, just like the arm model that we have. And then on his back, you'll notice that we have a superficial view and then a deep view, okay, which is nice. On the right side here, you can see his trapezius muscle really well, his lat muscle really well, latissimus dorsi. But over here, we've removed those so we can see things like the levator scapulae, which is this muscle right here. Remember, that's going to lift the scapula up. We can see the various muscles associated with the scapula pretty well. Supraspinatus, infraspinatus, the teres minor, and then the teres major, which you can see some of those over there. The thoracolumbar fascia is pretty good on here. So yeah, that's pretty much the major things that you can get out of this guy that you can't on the other one. Okay. You can stop.